in the entrepreneur campaign and get touched in the same year. And he just, had his followers to manage his company. After a year, since 2016, and he has devoted himself into Tzu Chi. And now he is always here with the medical mission. Ladies and gentlemen, let's give Brother Liao Weibo a big hand.
再次热烈的掌声欢迎廖师兄跟我们分享数据天空的智慧。
So Dr. Liao Weibo will be sharing with us finding wisdom in the numbers. So dear TIMA members from around the world, Master, and all attendees, hi everyone. Today I don't think I'm an expert in this field, but just a sharing of my few years of experience giving to Tzu Chi's medical information system. So today I'm very honored to be able to give this sharing. Last time I came on this stage was in 2014 in November in the retreat for entrepreneurs. In the closing ceremony, I was giving the sharing. I gave a sharing for my feeling toward having the retreat. That year we had 30 to 40 people come to that retreat. One was me. I was called up at the last minute. So I'd like to give you a brief recount of what happened on that day before I entered the main topic. So in the past, when I was about 40 years old, my company was in the U.S. I think it had reached the goal I had set for it, and I think I got into a midlife crisis. A midlife crisis is something that you probably don't hear much about in the medical profession because many of you have probably made a vow to be in the field of medicine to serve others. But for the rest of us, mundane beings, we feel confused. At about 40 years old, I'm thinking about what I do with the second part of my life. And at that time, I had already been lost for about 5 years, and I went to China to start my second career, to go into the real estate development. And then I came to know Tzu Chi and finally came to that Tzu Chi retreat in 2014. At that time, Master was my guide in life. She helped me find a direction in life. And midlife crisis comes in two types. One was I had been busy for 40 years. Then where do I go next? What is my goal in life? The other type is I have reached my life. Then what's next? What do I do next? Well, after reaching one's goal, that means one loses the goal as well. So what's important in life is to have a goal. And under Master's guidance, I found what my goal in life should be. When I was younger, I started my business in 27, and until today, my company is still running in the U.S. And my company has taken on some very sizable projects from the federal government. And the government's projects are around the same size as Tzu Chi's missions, and they are also quite complicated systems. And when I came back to Taiwan, Master told me that our information systems should be upgraded so they are current with the times, and asked whether I could help. So I made my vow in 2014. I told Master that if you need me, then I will do my best to help. So that's what I lived up to. and started on this path. So today it's a report on what I have done since I made that vow. So for that vow is the reason why I'm here today. So since the time I made that vow, in English we say it's 724, means a complete dedication to the mission. In the past, I used to go back to the US 4 times a year because my company is located in the US and also in China. But now as my wife and son come to Taiwan twice a year to visit me, I have not been back to the US in 4 years because I've been working at Tzu Chi's hospital, working alone. Until today, I have the chance to come out and share with everyone. So let's go into the topic for today. I hope that in this very short time to share with you, you will hear a lot of terms like the cloud, like AI, like big data. What are these things and how are they related to us? Hearing these terms, what should I use them? Should I not use them? Are these relatable to me in my everyday practice? So everyone may be full of questions, and you may be asking when you should start on this, whether I should buy the most advanced, the most current AI technology, or whether I should be doing things on the cloud or on premise. So in the past couple of years, I think that you have been to different seminars in artificial intelligence. So what is AI about? I hope that in my next 40 minutes, I can also share with you my experience. A few days ago, when I was looking at going to different sites, I saw this. Says a domain expert is this evil queen in the Snow White story. So she puts in a lot of data of all the females in the world. So this is the big data part. And then she asked the mirror on the wall, which is the AI. She asked, because she looks at the mirror and asks who's the most beautiful woman in the world. Of course, that would be oneself, because the mirror only shows our own reflection. So using the mirror as an analogy for big data is not very appropriate. However, we can say that the mirror on the wall is a bit like AI because it can analyze the data back in the data store and give us our questions. But is this the AI we want? Can it answer all of our questions? So today I want to use this time to explore this question with everyone. So the mirror on the wall says Snow White is the most beautiful woman. So let's assume that there is big data behind this mirror, and they went into a search, and the results came out as Snow White. So we rely on the inference, on the analytical power of the mirror. So this inference engine, how do we work from the data that we have to the result that we want to get? Well, the middle piece, the missing piece, is the inference engine. So is this AI?
So that's safe that the situation, the thing I just shared before, earlier. So for now, is it the transformation of the technology, or how is it like leading the medical field, the revolution, and create the innovation? So therefore, from many of the check in the hospital, all this data, all this information, and the technology will come with that. And how the AI can cooperate with the data. And this is how technology can be go with the medical data. And that's the request and needs. Because of each of it are needing each other. And the whole process through the big data. For through the medical informations, aiding on what we get from our community, and also from the government parts and healthcare department, and all the numbers, once they are not systemed, and then through the Google search, and once they do the searching, and then once you do the searching, and you get anything you want, and that is a big number, big data we have in our hand. But if we can system them, and then which you get the answer. Therefore, the big data and also the system and analysis, what's the differences for the statistic and for the researches, for the medicals, and also there are also other number resources are combined. So how do we structure it? How do we combine it? How do we search it? Therefore, for here are many of the terminology here. So what is AI? What is CDSS? What is knowledge base? So why is AI is so famous and everybody are asking for that? For in the beginning of the years, the AI system is not as working as well as nowadays. There are a lot of people who can't do their academic well. They go for the AI major. So therefore, in the beginning, there wasn't a lot of people who were keen to learn the AI major. So therefore, there will be a lot of people ended up in the school to learn about it. But why those people having this major, they couldn't get a job after they graduate, but they ended up still doing the research for the AI major. So in the beginning, because of the system can't be cope with. But however, AlphaGo through the it can be calculating with the thing they want to do. So therefore, from any witness or anyhow, it can still be working with the machine, the system nowadays. So it's quite different from the early time. So after, so for the AI.
So what's relied on is Monte Carlo simulation and also just trying the different search on this decision tree. And if we use a decision tree in the medical decision making, it doesn't work well because there's a lot of knowledge in the doctor's head, and to turn this knowledge into a decision tree. For example, if I have a headache, I have runny nose, and I'm coughing. If these things are entered into a decision tree, then we need a doctor to maintain the decision tree, and through all the complicated logic that cross together in the neural network that produces logic at the end. But ultimately, these decisions are all results of if-then logic. When I went to the US, I had a headache for about 3 years. I thought to myself that if I had a headache after waking up, then what's the problem? Well, it's probably high blood pressure. So I went through a bottle of Advil per year for 3 years, and finally we discovered that it was not high blood pressure. It was allergy that caused my headache. But this result came only after 3 years of taking Advil and after a lot of tests. So basically, the result was I was allergic to many things in the air. I was basically allergic to air. But after treatment, my headache was cured. I don't need the painkiller. And this result in the clinical decision support system that we use in practice, has evolved into something we call expert systems in its second iteration, in second generation, which is we take the human judgment and we write it into the decision tree through all of this if then else that gives us the final result. So we can try to get an idea of the cause of the symptoms. Now, right next to, I live very close to the National Institute of Health, and they spend billions of dollars building this knowledge base. However, it was a failure. All of its failures come back to know who is to maintain this if-then-else logic. So we developed recently, we hear a lot about machine learning. This is the machine learning by itself, and this increased intelligence of our machines we can see in like the S3, the newest iPhone. We see that they have a new chip that is responsible for all the AI processing of the images, such as beautifying the photos we take. Even if we are moving, they can remove this blur, the motion blur, and this is done by the AI engine that resides in the logic on the chip. So as we are talking about deep learning and machine learning, we mentioned AlphaGo's deep neural networks. It has two networks, the policy network and the value network. And for those of us who work in the industry, we know that we can try to calculate the value of each step we take, and then we can then consider the next step. So ultimately, AlphaZero was able to win because it forgets about all of the steps it has taken in the past, because its goal is to win, not about the next step it takes. It can forget about all the moves it has learned in the past. If we have a strategy in our head, then we may be bound by that strategy, by our past knowledge. And this is what we talk about in Buddhism as the knowledge barrier. The more we know, the bigger the barrier we have, and we are unable to go back to our original pure mind. And we are caught up in the everyday activities that we go through. And I think myself is a victim as well. I have a lot of afflictions and worries that come from my knowledge that have given me a lot of worries in life. So I like to
So I want to tell you about the progress of the medical department of Chiqi. So in 1995, it's been going for the electronic fight, and then for this year, 2020, Chiqi and ASUS, we have cooperate with them to do to have cooperate with the AI system and into the team. And last year, July, we start our cooperation. They start to enter the medical department. And of course, we thank you. We thank for when the group say that what kind of topic we should do. In the past 4 years, our doctors and nurses and each department, they had a lot of meetings, about five meetings each day. After 4 years, for me, I feel like I had a lot of meetings start when I was 30-ish. I don't know what's the meaning of the meeting. Nobody liked the meeting, but however, I had a lot of meeting with everyone. Because of these meetings, and we start to know a lot of needs and requests. And a lot of them have to jot down the notes of the each patient check, and also operation records and emergency records, and each records from the nurses, and also assessments. But however, for doctors, they have to see the quality of the records. When we were little, on the paper, we remember we saw them jot down everything on the paper, but it's hardly to read by the handwriting. But I'm not sure what kind of prescription he wrote. It was barely can be read. So therefore, we have to put that into electronic file and then give that to pharmacy to prescribe the medicine. So therefore, we have to system all the terminology for the doctors to use, and using the electronic files, and using the terminology they use. How AI to read it, to read the prescriptions. How do they understand the records from the doctors? How do we make them into system, make it into the record? So therefore, there should be a professional system. So there are many hospitals has been using those systems, but however, it didn't work well. And a lot of abbreviation has been done. And there will be a lot of abbreviation, but what are those for we to be used? So many hospitals, they start to establish or like records all abbreviation they used, but later we use the AI to solve the problem. So therefore, we tell the doctors, we're asking them to have them to restart to learn the abbreviation. So we start to using the NLP, natural language process. For that process, when we talk to the robot, and if the robot could understand us, but if they could understand us, and it would be like natural language. And sometimes people suggesting me that to talk in how we people talk. But if we talk into the professional way, you might not be understanding what I'm talking right now. So how the AI could assist the clinic decision support system. So for the doctors, they're checking on the patient by checking on their appearance and also checking your blood and MRI and everything. Once they checked from the patient, when the patient entered the hospital, and there will be a machine to scan through what kind of disease you get and what kind of pill you need to take. And that's what we hope for. But however, now we couldn't get this kind of machine because the doctors has to find out what kind of disease you get. So therefore, they have to try and error, and have a look if the pill could be work for the disease. But if you still feel painful with your headache, maybe it's a high blood pressure problem. And then therefore maybe antibiotic to be used for yourself. But it might possibly cure your problem with your headache. So there'll be like a try and error. How could we avoiding try and error problem? How could we let the patient and have the system to know whether this pill will be curing the problem? However, the assessment. So once your diagnosis has been assessed, and there will be a plan for your medical curement. So therefore, we'll see what's the result. How do the doctors can solve your problem to cure your disease and using the data? So therefore.
So we've been to different AI conferences, and they're basically conferences in how to read these medical images. So why is AI used in the reading of these scans? Because it is fast and it is also able to achieve a high level of accuracy. And because it also needs a large number of pixels, this image that is composed of a lot of pixels that we put into a GPU graphics processing unit. So this works in conjunction with the CPU of the computer. The CPU works on logic. Graphic graphic processing unit works on pixels. We add a math processor in the math processor in the GPU can look at multiple pixels at the same time, so it is able to look at process the image very quickly. What used to take 3 to 5 days to read in an image can now be done in a much shorter period of time. When I was in school, it took the a supercomputer of that time about 1 week to draw a picture. But now we can do that same task on our phones because such is the advancement in our hardware power. So whether you are looking at an image from a biopsy or from ultrasound or from angiography, the analysis of the reading of these images can be done at 90% accuracy by the AI system. We have thought about this. If we need to get medical professionals to look at the same image, different specialists should come to the same conclusion, but turns out not to be the case. So we asked 5 specialists to come to look at these images, and we use that result to train our machine. So the machine has learned to become more and more accurate because it is it bases its result on a large amount of computation. So this is something that is a good use for AI. And why does Tzu Chi not do it? When I was talking to the ASUS team, we're saying that, there are a lot of companies doing this AI image reading, but at the end result was they produce a tool for radiologists. And the doctor still needs to combine these reports the doctor still needs to combine the reports from different departments to make a combined diagnosis. And who helps the doctor with this? IBM had a system called Watson that can help with this. It can read the past history of the patient, and it matches the articles that have been in periodicals. It has access to all the textbooks and dictionaries, and finally gives a recommendation of, okay, this is the medicine the patient should take. So that's what the Watson system can do. And is this effective enough? That is a key of whether the system is able to help the doctor. So if we can help the doctor with reading the patient's record and comprehensively understand it, and finally give suggestions, diagnosis for the doctor to pick from. The doctor can then pick from these possible diagnoses, then maybe we can reduce the time of suffering for the patient. So I will not go into detail for this. A lot of different algorithms will say that they are better than doctors, they're more accurate than doctors, and that's our hope for them. But ultimately, we will find that the instruments we buy in the future will have AI functionality built in, whether it be ultrasound, CT, or MRI, or X-ray machines. They all tell us that these are the possible trouble spots that will be marked. So this is something that the medical device suppliers will be working on. But what we try to do is combine the reports from these different devices to help the doctor. There is a lot of data floating around every day. The doctor needs to look through. The doctor in Taiwan will be examining maybe 50 to 100 patients a day. So that is a lot of cases to process. So this is something we can help doctors with. And a lot of this data is unstructured. how do we deal with unstructured data on the internet? What used to be very troublesome in the past was a lot of medical the hospital certification program looks at how structured we are in our data, whether the fields are completed and whether we use terminology from SNOMED or UOM. And these are, so how do we solve these problems all in one go? Because if we want to structure the data and make them consistent, then this takes a long time. So with so many reports, we can help to read through for the doctor and develop intelligence, and also to give a diagnosis for the doctor to pick from. Now in Google searches through new papers, new articles every night, every day. So what does Google do with this information? Well, it indexes them. It looks at the keywords, and then it produces an index. It does auto tagging, and then does the analysis with the big data algorithms. So when we ask Google, what's the hottest show right now, then Google will tell us. So on what does it base this answer from? Well, doesn't Google need to?
Yeah, there will be thousands and thousands of information are sharing on the internet. And because every evening they do the sorting of the keywords, and then they will be categorized each keywords. So therefore, for ASUS, in the beginning last year, January, they had invited one of the experts from Google used to working there, a professor, and form a AI group. So for the AI searching, it will be a bit like the Google searching. So for now, before searching, we have to collecting all the data, all the numbers, and then we have to collecting from the 4 hospitals we have. And for Hualien, it's been 30 years, and many of the hospitals we have are over 20 years, and all these data, after collected, and then in the evening time, it will be have the calculated, and then send it to the AI system, AI engine, and there will be many models to be calculated. Once there will be a click, and we'll know where the data is. So it's very important. So for the platform, can be go across the years. So that means when we have the new CT or new MRI, and once we have the system and can have the old system and new system can be combined together. So for the medical, it's like I said, other than SNOMED, and I also went over the textbooks and also the international code, and with all this data and also the records, and then we combine with and how people live, lifestyles, and how people, whether the passion or having the habit of smoking, and all this data will come out. All the things you can see from the screen. We all know about AI, but about the artificial intelligence until now, it's quite different from the old times. In the old time, that was using the business intelligence for SARS and a lot of different disease. That was the tool to analyze the things. That's called BI. And what is CI? That is continuous improvement. And there will be a lot of signal effect and many professional things. So therefore, some of the system has to protect some of the information, and the regulation has to be followed. And if some of the other department asking for the things they want to, so therefore there will be a lot of protection for the system, for the data. So if maybe some of the PO can't be applied for the fee, so therefore there will be a lot of protection for each data or the information. But crossing from different departments. And other than the medical team, they are taking care of the patients. They couldn't have the chance to talk to other departments. So in each hospital, I just mentioned for the DI, data integrity, and they have to system every details. So that would be saying like data warehouse. So for all this, just let you know all this terminology. But for now, it's the essential skills. So for the article on the left-hand side, and that was the records, and that was a lot of paragraphs and how they treat the patients and what kind of headache, and everything has been jotted down in the records. And once you go into the AI system during the evening time, and start to taking all the keywords, you can see different color highlighted. And how do they know which word they should pick up? And some of the expressions, some are not high fever, and the system has to recognize whether it's the patient having the fever or not. So it should be navigated. So the AI engine has to be doing this. After sorting all this, and then there will be calculating all these the keywords, like headache. Is it a headache connect with link with the fever? And also medical disease. Is there any is that connected with the complication? And also with the disease and some certain lung disease. So it will be analyzed by the system and how each word to be linked together. So therefore, there will have the ICD-10 coding assistant, and this is offering the doctor the suggestions, what they see from the records, and the confidence of the records. So underneath, you can see from the brown highlighted within the blue color, and there will be many keywords related to the disease, and maybe coughing. And in the subjective will be described in there. And what's the percentage of all those analyses and description? And might be analyzing what kind of disease is that, and there will be percentage. You'll see the confidence of what kind of disease was recommended by the system. And if you click on the icon, and that will be also showing that what it's recommending is that kind of disease, and that will be helping the doctors and let them to know that, or maybe there's some other disease. Even they just looking through the records, but through the AI system, they'll know the possibility or the minor hidden the disease they might not notice from the records. So the AI will come out with the keywords. So from this part, from when the patient
So these records that are produced when during his stay are produced, and if the code is somehow in error, then we would not be able to get reimbursement from the health insurance plan. So the system will tell us the relative weights for each one of the codes and the different weights. And so these things are items that the system can help with so that we are able to produce a more accurate scoring for the patient's condition. So what we have just looked at is the core of the system that helps us process the relationship among the reports of the medical records of the patient and also the past diagnosis of the past 30 years. All of these things are, once they are all combined, then we can have other uses for this data platform. We can, because all of the data throughout the patient's stay in the hospital are also included. So number one is we can calculate KPIs for the hospital, and these are important for the hospital's accreditation by the national authorities. Now, these KPIs are normally lagging indicators, and our superiors will tell us oh, this KPI is not up to our standard, and the doctor is asked to go back and think about it, think about how to improve it. But now we can turn these KPIs into something that's real time, so that as we are carrying out different actions clinically, the system can tell us how this affects our KPI. So these are called key performance because it affects the quality of our medical treatment. So from these KPIs, we can integrate it into our clinical work. And this is something that the Health Insurance Bureau in Taiwan is very cognizant and wants us to maintain a good job on. So now the National Health Insurance Bureau tells us that when we treat something well, we will get paid for it. But if we don't treat the disease well, then we do not get paid. So this affects the hospital's operations a lot. And the doctor writes the progress note for a patient. In the first 3 days, we give the doctor a reminder that if the patient is discharged, then he has a high risk of readmission, and perhaps the white blood cell count is too high, or some other indicator is too high, then the patient can only be safely discharged after these indicators are lowered. So these reminders are very helpful for a doctor. So we calculate a score for the patient's condition situation. So with AI, we calculate these numbers, and it is actually more accurate than a previous system we were using. And as we just mentioned, these are, we look at over 300 indicators in our daily operations in the hospital, and they can all be integrated into our daily processes. There are a lot of numbers in our hospital information system, so that when our staff accesses the system, he can see all of this information. And so after building such a smart database, we hope that we can answer the doctor's questions. So for example, we've asked different doctors, and these are a sample of the questions that doctors hope hope the system can answer. For example, what is the correlation between knee operation and hemorrhage in the stomach? Well, in fact, there is a correlation, and the system is able to pick out that correlation. So this is helpful for doctors who want to do this research and want to develop their own deeper understanding to the cause of the disease. So our search is a lot like Google's search. We can ask anything, like if newborn babies are here for jaundice, do they have higher risk of this disease that was just mentioned? So this gives the doctor a lot of assistance. And this whole cycle, after the analysis, we hope we get feedback on whether the results were helpful to the doctor. So this creates a feedback cycle. So we go from data. Data is just 0 and combo of 0 and 1. It becomes information, processes to knowledge, and take this knowledge into intelligence. So how do we go from knowledge to intelligence? Intelligence is not wisdom yet. Intelligence is simply smart. We will get to wisdom in just a bit. So after coming to Tzu Chi and becoming a volunteer, the first half a year, I had a stomach ache. I was admitted to the emergency room, and after they scanned my stomach, they said, "Well, it was in bad shape, and I was in a lot of pain. So I was in the emergency room. So they gave me medication, and after half a year, I think that cured my stomach condition. So I stopped the medication, but after 3 months, I went into the emergency room again with a stomach pain. So did we actually find the root cause? Well, yes, it did have something to do with the stomach. However, when I went to see the doctor in Tzu Chi Hospital, he tells me, "Oh, that's very common. A lot of volunteers get stomach ache in their first half year here because of the pressure that they're in. They need to do a lot. They face a lot of interpersonal problems. So this is very normal. It'll cure itself after a while, but I was still not cured. But after learning more of Master's Dharma, Master tells us to let go. It's easy to say, but it's hard to do. And in the past 4 or 5 years working on this project, the first year, I was working on parting ways with my business. I was getting my staff to handle the office, and also thinking about how I can help Tzu Chi. And finally, I was able to say to Master, "I'm back. I'll do anything you want me to do." So I went to different things. I helped at the charity mission too, but ultimately it was the medical mission that I ended up in. So we have a lot of doctors, and they will also help to look after my stomach as well. As they were treating me, it was still not improving. So finally, how did it get better? Well, every day there are good news and there's bad news. If there's a good day, then the following day was probably going to be bad. But these worries also seem to go away the day afterward, because there will be someone who comes to my aid. So finally, I now come to a more calm disposition.
So this doesn't mean I have no feeling, but for me, I start to transform my mindset, and I start to shift my thought somehow to solve the problem I bump into every day. So for the wisdom, for my stomach ache, how does it cured? It's all cured by the Dharma from Master Cheng Yen, how she told us. And I have to change the diet. I have to change my lifestyle without changing. the old disease will still come out. So therefore, for this morning, and brother he shared about the karma and also effect and result. So from the physiology and psychology and all the physically and psychologically, all the symptoms, like doctor try to solve the problem we have, try to solve the illness we have, and it's mostly like the Dharma Master Cheng told us, and how we take care of ourselves, our mindset, and in our mind could get rid of the troublesome, or get rid of the from our mind, from spirit, and this is how we are all disciples of Master Cheng Yen. We follow her teaching. She's our leading teacher, and how she helps us to solve the problem we encounter every day. For 5 years later, for myself, let's think back what's most suffering for you, and what's the happiest moment you remember. But for me, and I start to think what's really troubled me. It's quite challenging at the time, but that's what I still remember most. So the last, for the past five to 6 years, for myself, I couldn't say wisdom, but it's just a little bit of the thing I feel and I learned, and without not too many emotions attached to the things. This is why I learned what is the right thing. Well, everyone usually thinks what they thought is right, and no one wants to do the wrong thing. We always do the right thing. But what is the right thing? But for me, myself. But for me, I think selfless is the right thing. But in the TV show, and I always say that, oh, what I did for you is good for you. And I thought, it's right. What I did for you, it's good for you. So is that real the right thing? Is that the true right thing? But for them, it should be right, not only for me to feel it's right. So that is connect with how we attach to the feeling. I have to get rid of the attachment. Whenever I thought if it's the right thing, it should be the right thing. Everybody feel it's the right. So it's not only the right thing, but also get rid of the attachment we have. It's not, we do not attach what things we see. So therefore, for understanding, if once you have the understanding, it's easier for you to forgive others. And this is how we take contentment and gratitude and understanding and forgiveness, taking to ourselves. And once we have compassionate mind, that will be a great help. And this is the great wisdom we should have. So I will share with you the wisdom and the compassionate is what I want to share with you. And thank you, Dr. Liao. And thanks for his sharing.